Hello and thank you for contacting Wave Support. I see from your case request that you have a post-refractive surgery patient where you're struggling with a little bit of lens adherence out in the mid-periphery. Well, if we look at your designs for a second, they actually look pretty good. Just a couple comments. As you know, with these post-refractive surgery patients, it can be very challenging to get them fit properly. And so sometimes, as long as the lens isn't causing any physiological stress to the eye, sometimes it's okay to get away with a little bit of adherence. But if we look at this design for a moment, the right lens, I see why you chose the back OZ that you did. It puts you kind of in the middle of that steeper zone. But quite often the importance of these kinds of lenses is to get this lens to line very nicely in this steep area. And if we look at your current design, we're a little steeper here centrally, and we got this little zone through here, which is probably where you're getting your bearing in through that area. With wearing this lens, you probably get a little pressing on this central part, causing the lens to eventually just adhere in this mid-peripheral section. So if you can get this lens to more closely align in through here, I think you'll do a better, have a little bit better performance on this lens. So I try to get this entire line to kind of smooth out a little bit more and match the cornea a little bit more closely. So a couple ways to do that. One thought is you could go with a little bit smaller back OZ to try to get that OZ to more closely line up with this area through here. Maybe go down to about a 5 or so and redesign that lens. Now I kind of I did a little mock-up here on here. I went down to 5 on the back OZ. I left it in axial mode, and then I went through redesigned the lens, and you see now I've got a lens that very evenly aligns across the cornea, a little bit more even distribution of the landing zone across the whole cornea. And I also threw a little asphericity in there. When you do that, when you get a little aspheric optical zone, in this case I made the lens a little flatter, and it gives you a back surface that really almost perfectly matches that front surface of the cornea. I would expect this lens to also give you a little bit more even bearing across that cornea. Now certainly you can play with these peripheral zones a little bit, but this might be a little bit more successful fit for you. On a side note, quite often if you recall these axial designs, they very closely match the central topography, but they don't represent this peripheral cornea quite as nicely. And axial in general tend to fit slightly steeper than the other option, which is tangential. So sometimes in these patients where I'm struggling to get this peripheral area of the lens to line more nicely, I'll actually switch over to tangential design and redesign the lens, because I think you get a little nicer look at that peripheral cornea using sort of the same fitting philosophy just in the tangential mode, and sometimes that'll help that lens flatten out a little bit more. Also another side note, just in general when I fit a lot of my lenses, if I have some lens awareness, if I suspect it's from those edges, sometimes just switching to tangential gives just a little less awareness for these patients. If we use the same thinking, if we go over to the other eye, again, this is actually a very pretty nice looking lens. I'm not so sure if you're having the same adherence issues on this eye. Just looking at it, I wouldn't think so. But again, we have an area that sort of matches this front surface of the eye, but I would like to see this back surface of the lens match the topography a little more closely. So in this case, what I did, I mocked up an option for us in a tangential design, and then I also threw a little asphericity in there, and now I've got a lens that has a pretty nice even distribution in this landing zone. And of course, once again, you can play with those peripheral edge lifts as needed. But I think those would be a couple options that you might consider when refitting this lens. And once again, if you're not running into any physiological stress with your current design, you may just want to stay with that and see how the patient does. As you know, these corneas, you don't always get a perfect looking lens on them. I guess one other option would be if you can't find a lens that's comfortable enough, sometimes you can switch over to a semi-scleral design. However, it sounds like you're awfully close on this current design, so I would hesitate to jump ship all the way to a semi-scleral design, but that would also help set the landing zone right onto the sclera as opposed to being on the cornea. But anyways, I wish you well with this case, and I think you're very close. Good luck, and thank you for contacting Wave Support. Have a great day.